And welcome to the House Health Committee. I'd ask the members, Delegate Johnson, we're ready? Okay. Thank you all for being here today. Welcome to this briefing. And I'd ask for your patience, as usual, if we encounter any technical or streaming issues. This briefing is being streamed by the Maryland General Assembly YouTube channel. Panelists will control the transitions of your slides. Before the briefing, all the members were emailed a copy of each presentation. If you don't have these documents, please let committee staff know and we'll get them to you. Please note that food and beverages are not allowed in the gallery. Delegates may have drinks at their desks just because sometimes these meetings might run long. Please, everyone, members as well as the gallery, turn your phones to silent at this time. We'd like the public to know that if a member is not in their seat, it is likely because they are attending another meeting, presenting another bill, but at the same time they are remaining informed of these proceedings. I'm going to ask the committee to please adhere to our usual committee rules of one question and one answer from the panel, not one question and one answer from each panelist. Please keep your questions brief. And this briefing is scheduled to conclude, I believe, at 2:30. And at this point, we are going to hear from the Department of Legislative Services, fiscal briefing, and Maryland Department of Health budget overview. So we will let you get started, Mr. Romans.
Thank you, Madam Vice Chair. So you can see on the screen, and it sounds like you have available to you our fiscal briefing. I'm going to just do the quick look part of the document, which is a short summary of what's in the budget, and then to the extent you have time, happy to answer. Sure. To the extent you have time, I'll be happy to answer questions once we're done. So overall, the budget is a $70.7 billion total plan for fiscal 27. It's about a $500 million increase over the current budget, a little less than 1%. It's worth noting the current year's budget is $3 billion larger than what you passed last session, largely due to deficiency appropriations to cover shortfalls in the current year's budget. A substantial portion of those are related to the health department and shortfalls in developmental disabilities, behavioral health, and in Medicaid. A couple of key points about the budget. The governor's plan leaves the state with a balance in the general fund of about $108 million at the end of fiscal 27, and it leaves about $2.2 billion in the state's rainy day fund. That's about 8% of general fund revenues. Other key point on kind of the big picture is that the governor successfully met the Spending Affordability Committee goal to reduce the structural shortfall for fiscal 27 from $1.2 billion to less than $600 million. He actually got it a little under $400 million. If we go to page 2, the document here, this page focuses on the Budget Reconciliation and Financing Act. The governor balances the budget with $1.5 billion of actions in the Budget Reconciliation and Financing Act. So without that bill, you'd be out of balance by about $1.4 billion. It breaks into revenues, transfers, and spending reductions. On the revenue side, the largest item, $150 million, is a kind of a technical accounting issue to transfer excess money in the local income tax reserve account to the general fund. The state over allocated to that account at the end of fiscal 25. Perhaps the most notable from a legislative standpoint are there 2 revenue items related to the One Big Beautiful Bill Act. That act included a number of provisions that provided relief to businesses, and a number of those flow through to the state tax forms as well. The governor is proposing to decouple, so to delink from the federal government on 2 of those provisions, one related to depreciation of production property and another related to bonus depreciation. That delinking would generate about $132 million for the general fund. There are other provisions that the governor is proposing not to decouple from, so to let the federal reductions flow through to the state. Under transfers, the most notable is the Strategic Energy Investment Fund, which sends $259 million to the general fund. That fund closed fiscal 25 with about $1 billion balance. They've seen a big surge in revenues over the last couple of years. I'll talk about that fund a little bit more later on. And then under spending reductions, there's nearly 600 million of reductions, but 450 million of it is just putting less money into the rainy day fund. So there's a required appropriation of 450 million to the rainy day fund. The governor's saying we already have 2.2 billion in the rainy day fund. Let's not put this additional amount in there. There's a couple of local aid reductions I think are worth noting for you all. The governor is shifting 39 million of retirement costs for teachers' retirement, librarian retirement, community college retirement to local governments. So your county governments will be paying those costs rather than the state. For counties that receive the disparity grant, the formula is frozen at the fiscal 26 level. This has a particular impact on Prince George's County, which would have gotten 17.5 million of growth, and Allegheny County, which would have received a little over 6 million in growth. The third local aid cut of note is 21 million of savings in the community college formula. The formula actually grows by 11 million. The governor just is capping the growth at 3% for each individual community college. This college is. And it particularly impacts community colleges that are seeing enrollment growth, as they're the ones who would grow more than 3%. There's a number of other items there in further detail in the document, but those are sort of maybe the most notable reductions. We go to the next slide. So this graphic is looking at the governor's forecast for the what his budget does in terms of the out years. And so the bars show the out year structural impacts. So when we talk about structural budget impact, we're comparing ongoing revenues to ongoing spending. So we ignore one-time transfers and one-time spending, just looking at ongoing. And the orange bars show you what the governor's forecast is. The blue dotted line was the legislative services forecast that we provided the Spending Affordability Committee back in December. And you can see significant improvement in fiscal 27, going from that 1.2 billion figure I mentioned before to less than 400 million, and some improvement in fiscal 28. But I think the takeaway from this chart is that in the next term, you face very significant budget challenges with the gap reaching $4 billion by 2031. So while this year's budget is not overly difficult to resolve, the next term you'll face significant challenges. Going to the next slide, just want to show you, well, how did the governor balance the budget? Because on a cash basis, we were projecting a $1.6 billion shortfall back in December. And this pie chart shows you 3/4 of the solution is actually spending reductions. And if we go to the next slide, this slide compares what we were forecasting, what Legislative Services was forecasting back in December, to what is actually in the budget. So it's sort of highlighting the surprises or the areas where we didn't expect to see savings or more spending. The biggest savings item is the Budget Reconciliation and Financing Act items I already talked about. And then there's about 345 million of fund swaps where the governor found federal funds or special funds that could substitute for general funds. But there are a couple of notable reductions I want to highlight, particularly in this committee. In the Medicaid and behavioral health area, there's 170 million less in the budget than we were expecting to see in fiscal 27. Most of that relates to behavioral health. There is not a significant cost containment that explains that. So we are concerned that the governor has underfunded the Medicaid behavioral health budget in particular, and we'll be looking at that in more detail when we do the budget analysis in that area. The other item I would highlight for you all is the Developmental Disabilities Administration, 150 million of general fund cost containment, which equates to about 300 million of total funds. And then over on the far right, you can see there's a number of what we characterized as enhancements or initiatives, and they're highlighted on the next slide, which just shows the detail. There's not any like one really large item, so I will let you all peruse this at your leisure. One thing I would note is there's 30 million for legislative priorities. So the governor's put a placeholder in there that the General Assembly can cut and then add its priorities into backfill. This is the first time we've seen the governor do that. In the past few years, the General Assembly's had to make cuts to actual things in the budget in order to create room for adds. There are quite a few items here that are kind of economic development related, as you'll notice. Sort of health related. AstraZeneca is getting nearly 15 million. This is the first of 8 payments. Over the next 7 years, you'll see them repeated, that to help attract them to expand a facility in Frederick and build a new facility in Gaithersburg. Turning to the next page, just want to highlight a couple of things here. The chart on that page looks at the Strategic Energy Investment Fund. As I mentioned, there was a big surplus, and this tries to show you how the governor is using a major portion of that. $333 million is used for budget relief, with $292 million going directly to the general fund. The other budget relief is using SEAF for SEAF-eligible purposes, but in places where, again, it helps balance the budget or helps support the capital budget. There are a number of new investments. I'll just highlight two. There's $100 million for ratepayer relief. You'll recall last session, the General Assembly passed a bill that authorized $200 million of ratepayer relief, which was provided through $40 discounts on bills. This $100 million would provide another $40 discount for ratepayers. And then there's $100 million for incentives to solar and clean energy projects that have been impacted by federal cuts to incentives for those projects. Also, I would note there's $42 million for higher education research centers to do research related to climate, energy, and resiliency. $25 million of that goes to the University System of Maryland, $8.5 million to Morgan State University, $8.5 million to Johns Hopkins University. The first bullet under that chart highlights K-12 education funding, which grows $359 million, nearly 4%. That's money going to the local education agencies. $228 million of that was a discretionary decision. State law sunsetted a provision that protected schools that are community eligibility provision schools and kind of guaranteed them a minimum number of students to be counted as free and reduced priced meal eligible. The sunsetting of that provision would have resulted in about 33,000 fewer students being counted as free and reduced price meal eligible. The governor's proposed legislation that will continue that protection for those schools, and that results in an additional $228 million of spending as higher numbers of free and reduced price meal students mean more compensatory education funding and more concentration of poverty grant funding through the education formulas. I'm going to skip actually to page 9. So skip a page. Here we just go through kind of the key fiscal issues for the session and perhaps in some cases for the next term. The most significant being the difficult fiscal outlook that the state faces in the coming years, which is exacerbated by the second bullet there by continued concerns about potential federal cuts both to workforce as well as to state and local funding grants, as there certainly remains a risk of more cuts in those areas. The decoupling issue, as I mentioned, is a significant one. The governor wants to decouple from some of the One Big Beautiful Bill Act provisions, but there are others, including depreciation for spending on research and experimental expenditures that he wants to go along with the One Big Beautiful Bill Act. As I mentioned, behavioral health being underfunded is a major concern that we have. In the transportation area, we're concerned about the legislative audit finding at the end of fiscal 25 that the Department of Transportation has charged $1.4 billion to federal funds, but doesn't have clarity that they will actually receive all of those funds. I think it is likely they will receive most of that, but there's certainly a risk that 100, 200, 300 million might not materialize, and that would be have an adverse impact on the Transportation Trust Fund and what it can fund over the next few years. The final issue I would mention is the Child Victims Act, which, as you all know, passed a couple of years back. 12,000 claims have been filed against the state before a deadline of June 1st, after which the amount that the state would pay out would drop. So the maximum liability is $890,000 for each of those 12,000 claims. There's not been any progress that we're aware of in terms of any sort of settlement negotiations. So this is probably not an issue that needs to be resolved this session, but it is on top of that structural budget challenge for the next term. You're likely going to have to find a way to pay for some sort of settlement in this area or court findings in this area. So it's another significant fiscal challenge. Last thing I want to talk about is the next slide, which looks at the Blueprint Fund, because the Blueprint Fund is a big part of the budget challenge and is the big initiative really that the state is trying to fund. And so the stacked bars show you the total funding to roll out and implement the Blueprint Fund each year from fiscal 25 through our forecast for fiscal 2031. And so what it shows is for fiscal years 25 to 27, you can see the blue bars, which are the ongoing revenues that go to the Blueprint Fund. So annual casino revenues, sports gaming revenues, a portion of the sales tax goes to the Blueprint Fund. That covers most of the costs in fiscal years 25 through 27. And then it's supplemented by the green bars, which are a surplus in the Blueprint Fund, because back a few years ago when the state had really large surpluses, the General Assembly put a lot of that money into the Blueprint Fund to help pay for the rollout. And that's worked very well. As you can see, that helps cover the rest of the costs through the fiscal 27 budget that's before you. However, we run out of that fund balance in fiscal 28. There's about $100 million left to spend in fiscal 28. And that's when the problem arises that we need to find another funding source to cover the implementation costs, which continue to grow at a steady rate each year. And that's the yellow bars, and that's where the general fund has to supplement the Blueprint Fund revenues. So that is a major driver. It's probably about 3/4 of your structural challenge in the out years is related to the Blueprint. Madam Chair, that concludes my kind of quick overview of the budget. Happy to answer questions if you have time.
I see I have a question from Delegate Kaufman.
Yes, thank you, Mr. Romans. I really appreciate it. You do a yeoman's job every year, and thank you very much. But given this committee, I was just wondering if you could walk us through a little bit more about where the $150 million in cuts to DDA come from, what the governor's thinking in terms of where he tries to contain costs. And I know it was in the budget, but there's just so much. So if you could go into a little more depth into the DDA cuts, I'd be grateful.
Well, if it's okay with you and the chair, right behind me are my team of health experts who are going to come up and present the health overview. And Victoria, who's one of our experts, is the DDA analyst, and she can talk in more length about the specific DDA cuts.
Great. I'm happy to park the question, Madam Chair.
Delegate Shalega.
Thank you, Madam Chair. Good to see you, David. Thanks for being here. A couple quick questions. On page 2, the Maternal and Child Health Population Improvement Fund. So Governor Moore is cutting $6.7 million out of that. What can you tell us about that?
There's a fund balance in that fund. The revenue comes from the Health Services Cost Review Commission's, charges on hospitals. Some money was transferred last year. The fund, I think, sunsets in another year, so they're kind of winding it down. So there's a very small amount of money left in the budget to spend from the account. So they're transferring the money to the general fund.
And that came from probably hospital tax assessments /
Yeah, okay. Assessments, yeah.
And then on page 4, the pie chart that talks about spending reductions. I think we had this conversation the other day. So are there any, the spending reductions, the 1.2, does that relate back to page 2? And this, what they're calling spending reductions would be taking money, not putting money in the rainy day fund. Is that where that money's coming from?
So the items on page 2 that are called spending reductions is about half of this number. And then there are non-mandated spending reductions. Again, some of them are reductions that perhaps are to increases, not necessarily, cuts below what was spent in prior years. I think really the most notable spending reduction is in the developmental disabilities area, where there's actually proposed changes that will reduce spending in certain parts of the DDA budget.
Okay, so we could say that the spending reductions could be found on page 2, which are things like not putting money in the rainy day fund, so I guess you're reducing your spending because you're not funding it. And then non-mandated, we could say would be a decrease in the increase, as we would like to say. They wanted to increase it by mandate, 20%, and they increased it 10%, so they're calling that a cut.
There's some of that, and then I'll use another example. Is so in behavioral health, we're comparing this to what we forecasted in December. In behavioral health, we expected an increase of more than $100 million. The governor actually has behavioral health for Medicaid going down very slightly, like a few $1 million, but he didn't do anything. He just is assuming more favorable trends than we were.
Okay.
So there's a
So
kind of
just-
combination of different things like that.
Okay. All right. And finally, thank you so much for indulging me. On page 6, budget includes enhancements. So enhancements, we're calling enhancements like the money to AstraZeneca, and you said they're going to get 7 years of, quote, enhancements. What's the total amount they promised?
They're getting $14.5 million for a year for 8 years.
14, but 7 is, what's that, a half a year? Oh, no, 15, I got you.
Yeah. So it's about it rounds to 15 million a year for 8 years.
Times 8 years, okay. All right, I have other questions, but that's enough, thank you.
Delegate Hutchinson.
Thank you, Madam Chair. David, every time I see this, it brings up more questions as I kind of go through the numbers. But what I've been thinking about is on page 2, we have the 2 funds that are being transferred to the general fund. That's the Bay Restoration Fund and the Waterway Improvement Fund. Yet we're backfilling those with bonds. So we're taking good money, cash we have now, putting that into the general fund, and then going into debt to replace that lost fund. Is that the way I understand that?
Yeah, that's correct.
Why would we do that versus, so we have a $108,000 balance at the end? Why go through that iteration and just say, not do that, and you end up with a $25 million?
Well, so the
Fund.
state always tries to leave a balance in the general fund of at least 100 million. And one of the reasons for that is we often find that we have shortfalls in the budget that gets approved. So as I mentioned at the start, there was $3 billion, not only about $1 billion is general funds, of deficiency appropriations in this budget to pay fiscal 26 costs. So we try to leave, as a state, some sort of fund balance at the end of each year to help cover some unexpected costs that may come up during the course of the year.
Okay. You can punt this to the folks behind you if you want, but on page 5, you talked about the DDA cost containment of a negative 150, but I saw further down it says DDA expenditure trends, which is a positive 85.
Oh, yeah.
What is that, and are we only looking at a $65 million DDA shortfall here?
So before the cost containment, to assume the cost containment didn't happen, the DDA budget is 85 million more in general funds than we were expecting. So the administration is saying this budget is growing even faster than was expected, and we had healthy growth in the forecast. So they came in with a higher number, but then they did the cost containment that brings it down. So it's a bigger growth than was expected by 85 million, but then there's 150 million of general fund cuts to help constrain the overall spending. DDA?
So is it safe to say that it's really 65 million that we're looking at in terms of DDA? Or do you want to punt that?
No, I don't want to punt it. Or I would say versus what we were expecting, the budget was bigger coming in. But then they did this cost containment, which obviously no one knew was going to happen. So the cost containment is real. It's going to be less payments to providers. It's going to be a cap on people's total DDA costs. You can only incur 500,000 or more in a year. So there truly is 150 million of cost containment. As I mentioned at the start, that's matched by federal funds. So it's really 300 million of cost containment in the DDA budget.
Ooh, good point. Thanks for pointing that out. Thanks, Madam Chair.
Delegate Rosenberg.
What is the total revenue loss to the state of Maryland attributable to provisions in H.R. 1?
So revenue loss is going to depend on what we decide to decouple from. So right now, so under state law for tax year 2025, the state automatically decoupled from the federal tax changes, and that's been in statute for many years. The idea is the General Assembly should get to decide what federal tax changes we want to see flow through into the Maryland taxes. So for tax year 25, we've decoupled entirely. Those businesses get the tax relief at the federal level. They do not get the tax relief in their Maryland taxes. After tax year 25, statute would allow the federal changes to flow through. So the question is, does the General Assembly choose to decouple? So the governor, so that if we don't decouple, we would lose over 200 million of revenue in fiscal 27. The governor is saying, let's decouple some things that would generate a little over 120 million of revenue. So the potential loss of revenue is 200 million or a little over, but we haven't lost anything yet, and it'll be up to the General Assembly to decide which provisions to go along with and which to decouple from.
And if I may, do you have any indications yet from Wall Street as to how this budget would affect the state's bond rating?
Yeah, so as you all know, back in the summer, one of the three rating agencies downgraded us from AAA to AA. The other two maintained our AAA rating. Concerns that were expressed by all of the rating agencies kind of going forward are one about just sort of the risks to our economy with the federal job cuts and so forth. That obviously gives them concern. But I think their biggest concern is our structural outlook, that we continue to have this big gap between ongoing revenues and ongoing spending. And they also want to make sure the state keeps a large rainy day fund balance. Now, the governor has kept a pretty significant, at least by Maryland standards, rainy day fund balance. But I think the risk is going to be that we make a little bit of progress on the structural budget outlook, but we still have a big challenge. I think they're going to remain concerned. I don't really think they'll necessarily take any new action to downgrade us in the, in the next year, but I think going into the next term, that's going to be a big issue for the rating agencies.
And to what extent is the blueprint a cause of the structural problem?
Yeah, so
And does
it's
Wall
about
Street-
3/4 of the problem. So like by 2031, we have a $4 billion structural shortfall. About $3 billion is blueprint and another $1 billion is all the other spending going on.
And historically, how important to Wall Street is public education?
I think that from the bond rating agencies, they're more interested in the bottom line, really. They want to make sure, do you have a strong economy? Do you have, are you a fiscally responsible state, which they usually give Maryland great kudos for? And then, do you have your budget, outlook kind of lined up well? And so that's why I think they've generally been positive for Maryland for a long time because we have a strong economy and we have done a good job historically in dealing with our budget challenges. And I think the question for them is really seeing us again deal with our budget challenge.
Thank you.
Delegate Morgan.
Thank you, Madam Chair. Thank you for the report, Mr. Romans. I had some questions on the decoupling as well, to piggyback on what Delegate Rosenberg just said. On page 9, it talks about $100 million from decoupling, and I'm assuming that's from the accelerated depreciation. But then on page 2, it looks like it's $122 million that they're adding in. So these would be tax cuts that were given federally in the big beautiful bill, but not being passed along to the citizens of Maryland and being initiated, I believe, through the state?
So on page 9, on the sub-bullets there's two of the One Big Beautiful Bill Act provisions that the governor is actually saying, let's go along with the One Big Beautiful Bill and provide the tax relief in Maryland taxes, just like the people are getting on the federal taxes. And that's the deduction for research and experimental expenditures, letting those costs be fully deducted in the year they're incurred. And there's a change in the business interest expenses provision at the federal level. And again, the governor's saying, let's go along with that. And that's about would be about 32 million of tax relief for businesses. So those two provisions would provide 147 million of tax relief if the General Assembly goes along with the governor and says, let's let these flow through to the Maryland taxes. Now, as you noted on page 2, however, there's two provisions where the governor says, I do want to decouple from the One Big Beautiful Bill Act. The second item under revenues, the decoupling from the production property depreciation. Currently, those costs get depreciated over 39 years in federal law and in the state law. The bill allows it all to be depreciated all at once when the costs are incurred. The governor's saying, let's not do that, and that generates 123 million for the state. That would otherwise, if we didn't decouple, that would be 123 million of tax relief for businesses. And then he's sort of partially decoupling from this bonus depreciation issue. So he provides a little bit of tax relief to businesses, but he's not providing 10 million that they otherwise would receive.
So, I mean, you could say, let's brief follow-up. So I guess you could say that is a tax on housing.
A tax on?
Housing? If you're not being allowed to depreciate,
These are business
accelerate it,
expenses.
and you're still,
I mean, these are business expenses. That one is really on equipment, so it's really more equipment than, I don't think I would call it housing.
you wouldn't call it housing if you can't accelerate it over real property?
Again, it's business property that they're not a home. It's a property that they buy for their manufacturing processes or whatever they need it for.
It would still apply to like an eBay, Airbnb, any type of furniture in the house, anything like that would be accelerated, be eligible, be accelerated depreciation federally, but not in the state. Okay, that's what I was getting at.
Okay.
All right. Thank you.
Vice Chair Cullison.
Well, thank you, Madam Chair. Thank you for your thorough run-through on things that often go over my head. I have a question, but I'm afraid it's not in your purview, so, and you can just tell me that. I have become concerned that we are not maximizing our federal dollar return in our, federal matching programs, particularly in Medicaid and SNAP. Do you all track that in the budget office, or is that tracked elsewhere?
Well, I mean, I think the challenge with that kind of question is that you need to spend money to get the match. So the question is, how much money, I mean, if we appropriate more money into Medicaid, if we raise provider rates, which the budget does not do, we would receive more federal funding, but it requires us putting in additional dollars out from the state budget as well.
I understand that, but I guess what I'm saying is I'm worried that currently, with the current spending, we don't always, for, a variety of reasons, particularly in the processes that are required to obtain the match, we're not getting the match. So I think, like I said, I think it's probably outside the purview of DLS and within MDH or, or another office, I think, or another agency.
Yeah, I'm not aware of specific examples where we aren't. I mean, I think both DLS and the Department of Budget and Management try very hard to find places where we can maximize federal dollars.
Yeah, that to me is, if we are losing funds, and, I've begun to uncover areas where I think we are, that's another source of revenue that we have not maximized. So something for us to follow up on. Thank you.
Delegate Rosenberg, do you have another question?
Thank you.
Go ahead.
Thank you. Do states have any discretion with regard to eligibility for SNAP or the Medicaid program in terms of work requirements?
I think states can apply for waivers to be more prescriptive on work requirements than federal law requires, but I don't think the state has a very much. I guess I need to think about, I'll see if Ann will have more time. I'll let Ann
Fine.
Braun, when she comes up, answer that, but she's our current Medicaid analyst. I mean, there's not a lot of flexibility. I mean, there's certain groups you have to apply the work requirements to. There are some groups where you can provide like in Medicaid, some hardship exemptions for people who have, substance abuse issues and so forth. And you have to identify those people and so forth, but there's not a ton of flexibility.
Thank you.
I just had a question for context. Am I correct that the federal government also had a bond rating downgrade shortly after the state of Maryland? Do we know the context of that?
I don't recall whether that happened or not. It's happened before that the federal government's been downgraded when there were extended shutdowns. I can follow up.
Okay, we can follow up. And do you know what the most recent, what the most recent CMS guidance was used for these projections? And do we feel any sense of assurance that we won't get future guidance that may make some of these projections a little squishy, for lack of a better word?
I think in the health area, the biggest area of concern, at least my sense from the health department, is provider taxes. I don't think they've seen all of the detailed information from the federal government to be sure that, for example, our whole hospital rate setting system and the provider taxes we recover through that are going to be fully allowable. But so I think they're waiting for more information in that area. I think that's one that's probably the biggest concern.
Thank you very much. And I've got another bite at the apple from Delegate Shalega.
Thank you for indulging me. It is probably the most important thing we do. Thank you. On page 9, you outline at the close of 2025, OLA identified $1.4 billion of federal revenue assumed by the Maryland Department of Transportation with no supporting information. There is a risk that these state funds will need to be used to backfill. So I didn't realize, I remember reading like 335 million, but 1.4 billion. So would this then be characterized as a deficiency because they've already spent this money and they just can't provide proper documentation?
It will become a deficiency if they aren't ultimately able to recover the federal funds. Now, the Department of Transportation feels quite strongly, and they've said so in writing in other places, that they will recover most, if not all, of the funding. That a lot of this is a sort of a paperwork delay, if you will, that they need to submit information and get the federal government to sign off on that, yes, that project was eligible for federal dollars and so forth. But if some portion of it, say 300 million, I'm just picking a number, there's no special, you shouldn't read anything into that number, it doesn't ultimately get claimed, and we realize we're never going to see the 300 million of federal funds, then that would be a deficiency where they would have to use Transportation Trust Fund dollars or State General Fund dollars to pay those bills.
Okay, so that, I think I recall 335 for some reason sticks in my mind was rejected by the feds. And has any of that been deemed unpayable, do you know? And if not, you can get back to us.
We have not been told that anything is unpayable. I mean, it's one of the things we're actually asking in the budget analyses where the agencies are responding to talk about, because there are other agencies that also have similar findings. And we're asking agencies to talk about, well, since the audit, have you been able to recover any of those funds? And if so, how much, to get a sense of whether they really are making progress in recovering these funds that they believe are going to be there. But, the auditors were not convinced they had any documentation on.
Thank you. Thanks for indulging me.
Of course. And I know appropriations is also working through their process, but if you do get those numbers, if you could share it with the committee. Thank you so much. And I know we have a further briefing from the Maryland Department of Health budget overview. From DLS on the Maryland Department of Health budget overview. Sorry, to clarify.
We're not going to present. Should I exit? Yeah. We don't want that done. No document. Yeah. Okay, thank you. Okay. Good afternoon. My name's Naomi Camaro. I'm a budget analyst with DLS. I'm going to let my two colleagues introduce themselves before we present.
Hi, Ann Braun, Deputy Operating Budget Manager.
Hi, I'm Victoria Martinez. I'm also a budget analyst.
Okay, we're going to present the fiscal 27 budget for the Department of Health. In fiscal 27, there's $23.2 billion in the Health Department's budget, which is a 4% decrease from the current year. On pages 5 and 6, we've summarized some of the federal funding that was thought to be at risk from recent actions at the federal level. We've noted that the Department of Health has not lost any funding to date. All of the grants, or most of the grants in that exhibit, have continued due to resolved litigation, and there's one grant that's continuing due to ongoing litigation. On page 7, we summarize the proposed deficiencies in fiscal 26 that are included in the budget. These deficiencies add a net increase of $2.5 billion to the fiscal 26 budget, and we wanted to point out that they include $718 million that are due to fiscal 25 shortfalls in the Behavioral Health Administration, DDA, and Medicaid. On page 8, this pie chart shows how the fiscal 27 dollars will be spent across the department. So you can see that a majority of the funding is going toward provider reimbursement payments. That's 88% of the budget going to direct health services. On pages 9 and 10, we've summarized the major changes in the budget compared to the current fiscal year. So again, the total budget is decreasing by about 4%. And I'll just point out some of the larger decreases. So there's that $718 million that I pointed out earlier that are due to shortfalls for fiscal 25 services. Not including the shortfalls for 25 services, looking at the provider reimbursement payments difference between fiscal 27 and fiscal 26 include growth of $148 million for traditional Medicaid, a decrease of about $53.5 million for behavioral health Medicaid services, and then about $149 million decrease in DDA, which does contain the cost containment that you heard about earlier. I also want to point out that these provider reimbursement funds do not include provider rate increases, as those were not included in the fiscal 27 budget for providers in BHA, DDA, and for Medicaid long-term services and supports. One more item I'll point out, which is at the top of page 10, is that there is an $80.5 million decrease in the fiscal 27 budget in major IT projects that the department has put on hold. Moving on to the Budget Reconciliation and Financing Act, there's several provisions in the BRFA this year tied to contingent reductions and appropriations in the budget. I'll just point out a couple here. There's a $730,000 contingent reduction in general funds in the Prevention and Health Promotion Administration, which is contingent on a provision that would reduce the mandate for tobacco cessation programs. There's also $20 million in special fund contingent reduction contingent on a provision that would reduce the funding mandate for the Consortium on Community Supports to $80 million. On pages 12 and 13, we summarize some of the trends with personnel. Looking at the chart at the bottom of page 12, we've shown the fill rates, the number of positions that are filled and vacant across the entire department. More than half of these positions are at the 11 state hospital facilities. And then I'll also point out that the fill rate as of December 31st, 2025 is a bit higher than it was at the same point in the prior year, in part due to the department filling vacancies, but also due to the elimination of some positions through the voluntary separation program, which is described on the next page. So the chart on page 13 just shows how the 47 positions that the Department of Health abolished through this program are split up between the different agencies in the Department of Health. Now we're going to move on to some of the issues that we've raised. I'll go through the first one quickly and then pass it over to Ann. So the first couple pages describe some concerns that DLS had with the fiscal 2025 closeout. At the end of the fiscal year, agencies are required to report their overspending to the comptroller. And at the end of fiscal 25, MDH reported a $411 million shortfall in DDA and Medicaid. That is included in that $718 million deficiency that I noted earlier. So we've just described the importance of ongoing monitoring of service utilization and spending to avoid large year-end shortfalls. We also talk about the fiscal 2025 closeout audit. So the Office of Legislative Audits conducts a closeout review at the end of each year. And at the end of fiscal 25, they've identified some issues with MDH's documentation of accrued federal fund revenue. So this is the backup demonstrating that the department has requested and received any federal reimbursements that they were eligible to. And this is also similar to findings from OLA in prior years. The department did hire an accounting firm in July of 2023 to try and recover some of these funds and improve their accounting procedures to prevent this moving forward. And they did provide an update for us in their testimony that they're continuing to work with that firm and looking at extending the contract. They also noted that they've recovered quite a few of those federal fund accruals. There's $6 million remaining in unsupported federal fund accruals, but the department has said that they feel very confident that they will be able to recover those funds and do not anticipate losing any federal fund revenue that they were eligible for. So I'll pass it over to Ann.
Great. The second issue has to do with the Rural Health Transformation Program that was passed as part of HR 1, or the One Big Beautiful Bill. I provide some overview information in this report, but I know that this committee just heard a whole briefing on this program just a few weeks ago. So I'll just highlight a few of MDH's planned initiatives. So that's on page 18. The first is $26 million to strengthen the rural health workforce. This would include funding for apprenticeship and training programs and establishing a new area health education center in Southern Maryland. The second largest initiative is $126 million for access and innovative care. That includes primary care activities that are managed by HSCRC, improving billing practices in local health departments, and supporting school-based health centers. The third is $15 million for nutrition improvement programs. One of these activities could be providing cold storage or refrigerators for healthy foods and produce. And the health department reported that it submitted its revised budget for this program to CMS on February 2nd. CMS has a month to review that, and so federal funding could begin to be released to Maryland as early as March of this year. The budget as introduced doesn't include federal funds from this program. That's mainly due to timing of when the funding was announced, since it was just announced this past December. MDH was asked to discuss the timing of bringing the funds into the budget, and they responded that there's multiple ways, either a supplemental budget or budget amendment later or deficiency next year, but they do plan to incorporate the funds into the budget. They just haven't figured out exactly which mechanism they're going to use. The third issue before you today is on the cigarette restitution fund. On pages 19 and 20, we discuss ongoing litigation with tobacco manufacturers regarding Maryland's enforcement of the settlement statute. When Maryland is found to have diligently enforced its qualifying statute, the state can receive additional CRF payments that are currently held in a disputed payments account. For sales years 2005 through 2007, the arbitration panel decided in Maryland's favor, and the expected payment from that decision was at least $25 million. However, more recently, in September of 2025, Maryland settled with a subset of the tobacco manufacturers for sales years 2005 to 2025, and that's expected to result in a one-time payment of $37 million that's expected to be paid this April. And so combined, those two payments could range from $60 million to $67 million, but the timing and the amount of that full payment is not finalized. And so all payments from those types of litigation are received in a separate account within the CRF, and that is required to supplant general funds under the HBCU settlement payment. The fiscal 27 budget assumes that Maryland will receive $70 million in revenue to that separate account. And this year's BRFA includes a provision that expands the use of funding in the separate account above the first $35 million to support uses other than the HBCU settlement. And so the first $35 million from that separate account is budgeted for the HBCU settlement, and the remainder of the settlement is paid for with general funds. And so the total $61 million settlement is fully supported in fiscal 27. As I mentioned earlier, the timing and the final amount of the combined payments are still uncertain. And so basically what the BRFA provision is doing is it allows the revenue from the separate account that is a little less certain, that second $35 million, to be budgeted, while fully funding the HBCU settlement payment with a combination of CRF and general funds. The remaining $35 million in estimated revenue from that separate account is budgeted, but notably the budget doesn't differentiate that revenue from annual CRF payments, with exception to $8.4 million in Medicaid. The budget actively replaces $8.4 million in general funds for Medicaid, contingent on the BRFA provision expanding the use of that separate account. Because there are no replacement general funds for the remaining $27 million, if the BRFA provision didn't pass, then the CRF supported programs would be underfunded by $27 million. We note that because, because the budget does not differentiate between the revenue from that separate account and from the annual CRF payments, it's not clear if that second $35 million didn't materialize or wasn't paid in fiscal 27, it's not clear which programs were receiving that revenue. And so DBM and MDH indicated that if there were any revenue shortfalls, they would resolve that as part of next year's budget process. On page 23, we highlight two other items in the BRFA that affect CRF spending. The first relates to a mandate for $8 million in CRF to support MCHRC operating grants. The BRFA would waive this mandate in fiscal 27 only, and so the budget as introduced reallocates $1 million in CRF from Community Health Resources Commission and instead uses it on Medicaid, which provides $1 million in general fund savings. The second BRFA provision reduces the CRF mandate for the Tri-County Council for Southern Maryland from $1 million to $700,000 each year, and so that results in $300,000 of reduced CRF spending. The last note is that statute requires 50% of CRF expenditures to support the programs that are listed on page 23. And so we would typically exclude revenues from the separate account when determining if this requirement was met. But again, because the budget doesn't clearly state where that revenue is going among the uses of CRF, it's not clear if the statute was met. And so we have a note that MDH and DBM should propose a BRFA amendment to waive that requirement in fiscal 27 only, due to not knowing exactly where the revenue was budgeted. That completes that issue. I'll pass it to Victoria for our final issue.
Thanks. So I'll be covering the last issue. The last issue is on home and community-based services waiver programs and on efforts to reduce the wait list for these programs. MDH currently maintains registries for the waiver programs for individuals who have requested services but have not completed eligibility determination or the application process yet. And so in efforts to reduce the registries, the End the Wait Act of 2022 required MDH to develop plans to reduce the wait list for Medicaid waiver programs by 50% by fiscal 2028, beginning in fiscal 2024. Exhibit 6 on page 25 shows the current status of the MDH administered waiver program registries. In fiscal 2025, the Community Options Waiver Registry increased by 5%, while the DDA Community Services waitlist decreased by 13%. To reduce the registry, this involves both increasing the number of authorized and funded slots and also fully utilizing already available slots. And so on Exhibit 7 on page 27, we provide an overview on utilization of slots in fiscal 2025. Available slots remained underutilized in the community options waiver, where 33% of available slots were unfilled, whereas DDA's Community Pathways waiver program did utilize most available slots with only 3% of slots unutilized. Since the community options waiver had the largest registry, Exhibit 8 on page 28 shows the results of additional outreach efforts for that waiver program. Although outreach has increased in fiscal 2025 and it even surpassed some of their outreach goals, the registry remains high due to a low response rate to invitations, a high rate of ineligible applicants, and importantly, a steady influx of new registrants being added to the registry. And the last thing that I'll discuss is on efforts to improve provider capacity and staff. Some additional updates on End the Wait activities provided by MDH included efforts to improve provider capacity and staff capacity across waiver programs. Exhibit 9 on page 30 shows the additional staff needed to implement the waitlist reduction plan with a total of 73 positions needed across waiver programs, especially within the eligibility determination division. I'll also note that DDA, for instance, had the highest need with a total additional need of 31.5 positions. However, DDA also currently has 30 vacant positions, so staffing efforts would need to involve filling already available vacant slots as well, or vacant positions. And that concludes this issue, and that also concludes our presentation. We're happy to take any questions.
Delegate Kaufman, followed by Taveras, followed by Madam Vice Chair.
Yes, I wanted to ask Victoria, I'm sorry, I forget your last name. More of my questions about, I appreciate what you said about the registry and everything, but could you walk us through in a little bit more detail the $150 million in cuts to DDA and what they're proposing? And I apologize if you mentioned it already, it's just it went super fast, so.
No, no worries. I haven't covered it yet. Thank you for the question. So overall, there's a net decrease of about $150 million in DDA in their community services program. So that's a net decrease of $150 million, and that includes both an increase in funding for the community services program of $150 million, but that's offset by $300 million in cost containment efforts. So that's why it's a net decrease of about $150 million. The fiscal 2027 cost containment includes 4 different items. There's one on enforcing dedicated hours so it includes more training for dedicated hours and enforcing those dedicated hours. The second item, cost containment item, is reducing reasonable and customary wages. These are wages for individuals in self-directed services. And then there's also, in addition to that, there's an elimination of the wage exception process for individuals in self-directed services for the wages that they are allowed to pay their providers or their employees. And then the last item is a cap of person-centered plan budgets. So the budget that each individual has in DDA, this would be capped at $500,000. And so those are the 4 cost containment items, and that's going to lead to about $300 million in cost containment from those items.
Brief follow-up, if I may. So I just want to make sure, you said 500,000. So as of today, there is no cap on the cost of a PCP, is that correct?
Yes, that's correct.
Okay, thank you, and thank you, Madam Chair.
Delegate Taveras.
Thank you, Madam Chair. With regards to the DDA community services and the unfilled slots, are we talking about, what exactly are we talking about? Are we talking navigators or specific type services? And do they work for the state, or are they embedded in other community services?
Yeah, thank you for that question. So the slots are actually slots for participants to receive services to enroll in the waiver program. So a slot represents, so in DDA's waiver program, they are authorized a certain amount of slots by CMS, and so they're allowed to fill all of those available slots. So that represents individuals being served in the program.
May I be allowed? So what are the concerns that I'm seeing is, or at least I'm being asked, is whether there are culturally competent navigators to help certain portions of the immigrant community or other communities that face these issues to be able to access these services. Is there a demographic breakdown on who are receiving these services?
There is a demographic breakdown of who is receiving services. I'm not sure if there's a demographic breakdown of who's those coordinators of community services that help individuals throughout the process. I'm not sure if there's a demographic breakdown on that.
I'm sorry. That,
Yeah, so your question was regarding a demographic breakdown of individuals receiving services for in
yes.
DDA?
In the DDA community.
Yes, yeah, there is data on that. I can provide that if you'd like. I
Thank
don't
you.
know off the top of my head, but yeah, we have that data.
Thank you.
And if you could just share that with the full committee. Vice Chair Cullison.
Thank you, Madam Chair. I'm wondering, how did we get to the 500,000? Is that based on utilization, prior utilization, or do you know how we arrived at that?
I'm not sure how MDH arrived at that particular measure. I can follow up if you'd like.
Or, that's fine, thank you. But the other question I have is, can you talk to me more about, I'm looking at page 10, the 80, I think it's $80 million in major information technology spending?
Yes.
Tell me what that is, and is it money that's been spent, or is it money that wasn't spent because everything was delayed? What's that money for?
This chart shows the difference between fiscal '26 and then the budget that's being proposed. So we're looking at like, what are the changes, what's increasing, what's decreasing. So when we compare to current year spending on major IT development projects, so the department has a lot of different like data systems in development. It looks like an $80.5 million decrease because they've put a lot of those projects on pause for fiscal '27. So it's resulting in savings for this coming year.
But did they spend them in the last year, is my question.
Yeah, in fiscal '26, there was funding for various projects. And I want to be clear, there is funding for major IT in fiscal '27, but the difference in spending comes to about $80.5 million. They spent a lot more in fiscal '26.
Great, thank you.
Delegate Shalega.
Thank you. Vice Chair was kind of started on my question, one of my couple questions. So of the major IT, I mean, that's been a big source of problem here with lots of stuff in the Department of Health. Are there specific programs that are IT, major IT spending that, 80 million less? Are there some specific programs that are not going to be funded because of this?
In fiscal '27.
Do you know what they are?
I can get you a full list. There's multiple.
Okay, that'd be great. And on that same page, 10 and 11, it talks about BRFA reducing general and special funds. So it looks like the BRFA, the governor's taking money out of some professional funds, like 1 million is taken out of the Advanced Directive Program Fund, and $500,000 taken out of the State Board of Professional Counselors and Therapists, and then some taken from the Board of Physicians. Have those fees been raised? Do you know? You probably don't know that. So my concern is this. Those fees were, these are licensing fees, correct? Mm-hmm. So they've raised the licensing fee. Now they have a surplus, which they may be saving for something, because they did this in previous administrations, and some of these funds were saving money to install a new IT system or something they were saving money for, and then, the governor comes in and swipes all that money out of there. So that, you don't have to answer right now, but my question would be, have they raised the fees for professional counselors and therapists? And then it created a surplus, and then they took it and put it in the general fund.
I can answer for professional counselors and therapists. My understanding is that there was no increase in the fees raised. It was just a balance that had accumulated because of underspending.
Okay, all right, and the physicians as well? I think they raised their fees.
Physicians, I'm not sure. I can double check.
Okay, again, I didn't expect you to, you all are great, but, the detail on this is incredible. Thank you for your presentation.
Delegate Gazoni.
Thank you, Madam Chair. I have a couple questions, if I may. One is on the $500,000 cap. Do you know about how many individuals are going to be affected by that cap?
Yes, it's about 864 people that are already exceeding this cap.
Okay, and is that all self-directed?
I'm not sure the breakdown of traditional self-directed. I think I can get more information on that.
Okay. My other question goes back to some of the questions about the IT spend, and you said that those are because things are on pause. Can you give us a sense of what the pause is? Is it because there's changes at like a CMS level, and so we're kind of on hold until that becomes more clear, or just if you could give us a general sense of what that is?
My understanding is that it's putting certain projects on pause as a form of like cost containment, but I could follow up with you. I think the agency would be better equipped to answer.
Thank you. Thank you, Madam Chair.
Okay, Delegate Rosenberg.
Thank you. Yeah, I speak as the sponsor along with then Chairman Rawlings of the Cigarette Restitution Fund, with a little help from Senator Neal to save the bill in the Senate. But what history, is this the great, what history do we have in terms of money being diverted from cigarette prevention? And this is all action in the BRFA, I assume.
So for the separate account that was created a couple years ago, I think that just last year, there was a BRFA provision that allowed the separate account to be used on Medicaid expenses. And so this year, the BRFA proposes using the separate account for other uses as well. This time it doesn't specify Medicaid. 8 million will be used for Medicaid, but there is a history of last year using the separate account for other uses. But I just want to clarify too that the separate account is dedicated to supplanting general funds for the HBCU settlement, but the settlement is still paid and fully funded. It just is either general funds or it's special funds from the Cigarette Restitution Fund when settlements and payments from the litigation are received.
Thank you.
Delegate Hill.
Thank you, Madam Chair, and thank you all for this work. I wanted to follow up on Delegate Gazzoni's question about the 500 cap. 864 people in the program, currently their budget's already exceeded. I'd like to know how many that leaves who are under budget or just, and if you can tell us what is the range of excess? Is it a few dollars over, tens of thousands? I mean, how much are they exceeding if the ones are, and how that stratifies, so we have some idea of how tight this will be?
I can follow up on that. I don't know exactly the ranges.
All right, thank you.
Do you have a number of how many are just utilizing that program currently that would be subject to the cap in total?
So the cap would be for everyone receiving services in DDA. So everyone in the community services program in DDA, it's about 20,000.
Thank you. Seeing no further questions, I believe this concludes this portion of the briefing. And concludes the briefing. Just wanted to make sure I was accurate on that. Thank you very much. Thank you for your time and your attention and for the thoroughness of your information. For our planning purposes, we have a break. We will be concluding this briefing and we will be returning at 2:30 for bill hearings.